Okay, this is part 2A. I'm going to do this one in 2 different videos to make sure that it uploads to YouTube. Wanted to talk a little bit about how do we assess students with disabilities and severe disabilities. So here I'm going to get a little bit more technical and talk about some of the ways that we do this. Some of this language you're probably familiar with and you've probably heard of. It may be a review for some of you. Some of you may be well versed in this, but it's certainly information that's important because I know that as teachers you're going to come across this information, and best to know what they're talking about rather than second guessing yourself. I wanted to first start off with just a brief discussion on standardized testing versus non-standardized procedures. The characteristics of standardized assessments: you have a preset administration procedures, and there is an objective scoring or an objective system for scoring, as well as a specific frame of reference. Proof of standardization, and I know we've all heard these terms, that a test is, a standardized test needs to be reliable and valid. So just as a quick review, test validity really refers to the extent to which a test measures what it's supposed to measure, as well as reliability, which is when the test reliability refers to the extent to which an instrument is consistent in measuring whatever it proposes to measure. So there's a little bit of difference there. Again, test validity, the extent to which a test measures what it's supposed to measure. Reliability refers to the extent to which a certain instrument is consistent in measuring what it proposes to measure. So those are just some characteristics of standardized assessments and what we should be looking for. You might have heard a term referred to as norm-referenced interpretations. When we talk about norm-reference interpretations, basically we are interpreting a student's performance by comparing that student's performance to that of his or her peers, which is the normative sample. Tests are given to the normative sample to determine an average score, and that normative sample can be selected from either a classroom or a school district, or it can be done nationwide. Normative samples must be reported then by the test publisher, so that information should be available by the people who publish that test. Information that is typically reported in these results of norm reference interpretation would be raw scores of students, the standard scores, percentiles, age equivalents, and grade equivalents. Grade equivalents, those are usually reported in the results. As opposed to norm-referenced interpretations, we also hear about criterion-referenced interpretations. And this is when we are comparing the performance of students to the mastery or understanding, the maximum understanding of the content that is being tested. So we're looking at making a determination of whether students have learned what has specifically been taught to them by the teacher. Typically, your mastery is considered as being achieved if students perform at about 80 to 90% it's achieved if students correctly answer about 80 to 90% of the testing items. Okay. Non-referenced interpretations, here you have measures that are not norm reference, nor are they criterion reference. The measures are intended to identify strategies that a student uses. And process assessments would fall under here, where these type of assessments would allow someone to identify the strategies used by students. And typically we see both passive and active assessments under this process assessment category. Passive assessments examples would be where you might have had the student do some kind of worksheet, and as a teacher you are taking the information that they've already completed on that worksheet and analyzing the students' answers, looking for trends and patterns to see how they've done. An active assessment under this process assessment category would be where you as a teacher are more actively involved in getting the information from the student, perhaps in something like an interview where you the teacher are interviewing that student. Another type of assessment that we often see used to help gather information about students with disability are screening procedures. And these are often used to just identify quickly and efficiently whether students have difficulty in a particular area. There's a lot of variety and different types of screening instruments that can be used, and usually there are benchmarks that are established within. So as you are screening the student, you're screening them and seeing where they fall against those benchmarks. Diagnostic assessments provide much more in-depth assessment than screening measures. If, let's say, you've done a quick screening type of assessment for a student and maybe they didn't meet the benchmarks in that screening test, then perhaps they've moved on to the teacher or guidance office will want to do more of a diagnostic assessment at that point if that student's not meeting the benchmarks on the screening. And the type of diagnostic measures that you might see here are looking for information that would provide detailed analysis of strengths or weaknesses in a particular area for a student. And this is where we oftentimes see, as a result of that diagnostic assessment, leading to a diagnosis of a disability by the special education team that is put together in the school. Okay, so hence the name diagnostic assessments. They're making a diagnosis of whether or not that student is, has a qualified disability under the laws. Observation is another form of assessment that we often see, and I think personally that we probably don't consider this or use this as well as we should, or as often as we should. Well, we probably use it often, but I'm not sure that we as teachers consider this to be an actual assessment information that can be used to help drive our decisions in what we do as teachers. Observations are very powerful and really should be combined with data derived from other types of assessments to make educational decisions. I'm sure there are some of you as students who maybe do not test well, and maybe you don't test well on those standardized type of tests. I happen to be one of those. So certainly you wouldn't want to make all your decisions based on one type of assessment without combining some different information to make a complete educational decision. And observation is a great tool to use, especially for kids with severe disabilities, because oftentimes, as we know, they may have difficulty communicating with us, and so observation is going to be what we have to rely on to make some of those determinations. And observing kids during seat work, as well as interaction with peers and other adults, can be really valuable information, and it can help us not only get some initial information for eligibility kind of things, but also in terms of what we as teachers are going to need to put together when it comes to actually teaching them. Interviewing is another form of assessment that I think is very powerful and very helpful. We've all heard, probably all heard that term think-alouds. Think-alouds are something that we use in the classroom where we ask the students to talk about how they've arrived at a decision, or basically to share their thoughts as they're trying to solve a problem or an answer. Interviews are great for this. And basically it's aimed at identifying the type of cognitive strategies that students use to solve problems. Some of the factors that may affect appropriate use of this approach: number one, the person who's doing the interview has to be a pretty good observer of student performance. So during the interview, you're going to want to make mental notes and perhaps notes on the student performance during that interview, because all of that information is going to become very important. The interviewer also needs to be very knowledgeable about the curriculum being used, as well as the interviewer really needs to know that student well and be familiar with the typical cognitive strategies that are used by the students. So that would be the think aloud interviews, and getting information about a student that way, one-on-one, which we know is so important to do. Additionally, interviews could certainly be used with parents of students with disabilities to obtain the developmental history and other historical information that will become important as we look at the educational plan for the student. Okay, that's the end of Part 2A. When we come back, we'll begin with Part 2B and continue a discussion on how different ways to assess students with disabilities and severe disabilities in the classroom.